Pelican Arrows, Creighton to Shambo Lake.
Pick any detachment in Saskatchewan, and RCMP Sergeant Joy Prince has been there.
Melfort from the James Smith, Humboldt from the Humboldt Broncos crash.
The sergeant leads mental health programs for Saskatchewan RCMP members, helping them with things like depression, anxiety, panic, and worse.
I have had to help assist with suicidal employees. We're humans first, and taking care of ourselves and our mental health will benefit not just us, but will benefit our families.
Now a new report suggests Prince's job is needed more than ever. University of Regina researchers found 65% of RCMP officers showed signs of one or more mental health disorder. 5 years ago, it was 50%. The report, paid for by the Mounties Union, suggests RCMP officers are 6 times more likely than other Canadians to have a mental health disorder.
If we don't address those kinds of challenges, we end up at increased risk for the officers having any number of different kinds of compounding challenges. So they could end up off on leave, in which case we're reducing the number of officers that we have available.
Researchers suggest that increase could be due to factors like a record high number of unfilled positions, the pandemic, and more natural disasters forcing officers to do more with less. But also possibly a culture shift, more officers just sharing how they feel. The union hopes this report pushes the RCMP to increase existing programs and access to help like online counseling.
It's not just with the RCMP, it's right across all first responders. And it highlights the fact that, hey, okay, there's something going on in these services here and we need to figure out what it is.
The RCMP says it takes mental health injuries seriously. In a statement, the police force described several ongoing programs and pilots, including its own process to get members back to work after traumatic events. The union says that's great, but the ask is for more, a request the RCMP says it's reviewing. Sam Sampson, CBC News, Regina.